Hi, everyone. My name is Abby Peterson. I am the founder and executive director of Magnify Wellness, which is a platform whose mission is to ensure that everyone gains equal access to mental health support. In today's video, we are going to be interviewing Molly Zive, who is an incredible mental health advocate and works professionally in the mental health space. The purpose of this YouTube series is to educate and inform the younger generation of taboo mental health topics that are not normally discussed in our education system. So let's please welcome Molly, and she can introduce herself now.
Thank you, Abby. I am so honored to be here. Thank you so much for having me. So my name is Molly Zive. I'm a licensed clinical social worker. I always like to introduce myself as a human first, because I think that's really important when dealing with clients or just people in general. So I'm a human first, mental health advocate. I have a podcast called Therapy is Cool, and I have a private practice where I see clients for therapy. So yeah, it's really fun.
Wow, that's really awesome. She has her own podcast, her own private client base. That's just really cool. So yeah, we're gonna jump right in and talk about her work and the importance of self-love and how to avoid toxic positivity when it comes to that. So Molly, I want you to tell us about your career and how you've helped people in the wellness space through your career.
Good question. So starting out in my career, I always knew I wanted to be a social worker. I was a teenager and I suffered from panic disorder. And I remember working with a social worker, and I felt relief. And I thought, oh my gosh, if I can make one person feel this way, I need to do it. And so I've always had great empathy and compassion. And so I knew I had those gifts, and I thought, what better way to use those gifts than to be a social worker. So I got my undergraduate degree from UCSD. They didn't have social work program, so I always knew I was going to get my master's. And then I got my master's in social work from USC, and I worked in very intense placements. So I make a joke that I start out like an inpatient setting, which is when people are hospitalized, like very sick individuals who are hospitalized. And then throughout my career, I've kind of done the step down with them. So once you're discharged from the hospital, then you go to an intensive outpatient program, which I worked in that. Then you level down to a couple other programs. And now I'm doing outpatient therapy, which is usually on a weekly basis. I meet with clients, and I specialize mostly in self-esteem, life transitions, and anxiety.
That's really awesome. Wow, you sound like you've done a lot in your career in a short amount of time. And right now, this world really needs comfort and in these really challenging times. So it's really awesome to have people like you that are really making a difference. So what do you see as the biggest problem for the reason why so many people struggle with mental health in my generation?
That's also a very good question. I could tell you put a lot of thought into these. So I think there's a lot of factors. I think mental health has had a stigma. I think I'm a millennial, and I think my generation has come a long way from our parents, who were typically baby boomers, who it was so stigmatized. It was so you have to be crazy to go to therapy. You have to hear voices. You have to be absolutely psychotic in order to go on medication and to benefit from therapy. And so I think that we're entering a realm now where mental health is just part of our health. It's part of our holistic overall well-being. And so I think that there's still a lot of barriers and still a lot of ways to go in normalizing that experience, because I think that in your generation, you're still very young, and you probably just, you're either living with your parents or you're outside of the home, and you're trying to formulate your own opinions around mental health. You could be having beliefs that you may pick up from your grandparents, your uncles, your aunts, your parents that maybe don't align with, you can be a normal person and just need a little bit of support working with a mental health professional.
Right. And like you said, there's just some of our parents, who are baby boomers, or they grew up with that because that's what they know. And we're trying to change that because everyone goes through rough patches. So it's important to realize that sometimes you just need someone who has a bigger knowledge than yourself to kind of get out of that rut that you're in. And you do not have to be having an underlying mental illness to do that. So it's really great that you're doing that.
I totally agree. Yep.
Yeah. Um, so why do you think people struggle so much with their self-image and self-love? Like, why do you think that's a problem in the first place?
Yeah, I think again that goes back to where do we begin to have these beliefs? Like a
Mhm.
lot of time our beliefs, so beliefs are thoughts you just have over and over and over again. So they become stronger. And at a certain point in life, you gain these beliefs by being conditioned, whether that was from your parents, your community, and then we have this overall media aspect. So growing up, I didn't have social media, but in your generation, you do have social media. So you're constantly comparing yourself to other people. When I grew up, in the media, you had to be very thin, white, blonde, and just look like you had it all together and kind of like a little bit of damsel in distress. And so that was kind of the image that a woman needed to be.
Mhm.
And so I think that media portrays to us what the ideal person should be. And I think that social media takes it a step further where you're constantly having FOMO, like, well, this girl gets to go and do this, and this girl's a model, and why do they have 1 million followers? So I think there's a lot of comparative messages that we internalize, and whether we're conscious of it or not, it's happening every single day.
Yeah, I totally agree on the media part. Like I myself sometimes find myself like looking through like different women and how they're traveling and they have really good friendships and relationships, and I just look at my life when in reality I do have those things. It's just people only, show their highlight reels. You don't get to see the backstory of what they're going through. So, what are some ways do you think my generation could maybe not completely stop comparing ourselves, because there will be days, but to take little steps to prevent having a negative mindset on self-comparison?
Yeah, I think it really comes down to self-compassion. And there's so much research around self-compassion. I think becoming aware that you're even having these thoughts. Like sometimes we get ourselves so dug deep into depression or feeling sad or really bad about ourselves or feeling fat and like telling ourselves these messages without having that reality check. So I think that becoming aware of your thoughts is the first step. So why am I having this thought? Where is this thought coming from? Being conscious of that thought. And then the next step is creating affirmations for yourself. I have a beautiful smile. I have a lot of friends. I love to travel. I'm a good person. So I think that building that awareness around what thoughts am I having and then replacing them with some affirmations. I like to keep Post-it notes. I have one right here.
Me too.
Of affirmations all around my house just to remind me when I do feel bad and I am feeling low about myself.
I love that. Oh my gosh. I love Post-it notes so much. Like I have some on my wall and one of them says, choose joy. And another one says success is not linear. So totally agree with using Post-it notes for positive affirmations. I love that.
Yeah.
Yeah. So how do you encourage your own patients to practice self-love besides positive affirmations?
So I like to assess what makes them feel really good. So when do you feel your best? Is it first thing in the morning when you wake up? And then what do you like to do? I like to create, so some people have morning routines. I like to call them rituals, kind of like a way to come home to ourselves where we just like really get in a positive mindset. And we, I recommend my clients to write down 5 things they're grateful for every morning, especially the people who are suffering from anxiety and depression. I think it's really important to start with gratitude, and then your brain starts to attract similar thoughts. So if I stay grateful for certain things, then I'm going to start attracting more thoughts that make me grateful. So I think gratitude is like the number one thing. Doing it first thing in the morning, it would be incredible. But going back to the assessment with each person, I think each person has different inspiration and things that light them up. So let's say you love reading books. I would encourage you, it sounds so simple, but like if you like going for a bike ride, taking a walk, like we can't do the obvious scrolling. Like that's not good for the mental health, or the obvious chore, the obvious chore of like, oh, I got to go do the dishes. It's like, yes, it is helpful for your mental health, but that's not taking care of your mental health. So I think having a good relationship with yourself and doing things that you would do for a loved one, again, going back to self-compassion, how would you talk to a loved one that wasn't feeling well? How would you treat them? And turning that into yourself.
I love that advice, because I feel like oftentimes my generation, they would never say the things to other people that they say to themselves. Like I'm not good enough, I'm not pretty, I'm not smart, I won't be successful, when you would not say that to your friends and your family. So it's really important to, like you said, practice self-compassion and rewire your thoughts to focus in on like self-compassion and gratitude for sure. And that kind of goes into my next question, where, you know, like there's a mental health stigma on where like it's not good that you feel bad sometimes. And then and so there's a definition that I've kind of heard of, but I'm not really like entirely sure about the implications of it. So I've heard of this term called toxic positivity. What is your definition of that, and how can it like harm other people?
Yeah, the way that I define toxic positivity is the belief that you always have to feel good and you always have to be happy and up all the time, and your mood has to be great. So in my practice, I see a lot of comparative suffering. So with COVID-19, some people like can't go off to college. Maybe they're really burnt out in their job. They're just not happy, but they do this comparative suffering where it's like, well, no one I know has died from COVID-19 and I have a paycheck, or, you know, no one, it's the suffering, like, I'm not allowed to suffer, when, you know, your own experience is very real. And so that's why like some people just blow past their negative feelings or emotions because they believe that they can't suffer because they're not as bad off as someone else. So toxic positivity, I tie it back into that, is, you know, the belief that if you were to come to me and tell me that you're really sad or, you know, really frustrated with a friend, I would just be like, you know, buck up. At least you have a friend. That's toxic positivity. That's not, you're not honoring the emotion that's coming with it, and you're just totally bypassing like that emotional need that you're trying to communicate and just trying to turn it into, well, at least you have this. You know.
Definitely. I feel like a lot of people unintentionally do that because they're, you know, they're trying to be helpful and they're trying to say something, but the delivery is just not exactly what the other person needs to hear. So I feel like, like people need to learn how to validate other people's feelings. And that kind of ties into my next question with how does someone avoid accidentally saying something that has toxic positivity in it?
So as a therapist, I have to do a lot of active listening, which is basically I listen to people all day. This is like the most I've talked all day. I've had 4 appointments and this is the most I've talked because I actively listen to what people are saying. So when someone comes to you for an example, can you give me an example of like a thought that you may have or a feeling that you may have?
Sure.
That's negative? Yeah.
Sure. Well, right now, sometimes I feel that that I'm alone because so I'm doing university from online right now, and because of the pandemic, and so I'm choosing to stay home for a little bit in order to make sure that my parents stay safe. And then also like my friends are also quarantining as well. So sometimes I feel a little isolated when in reality, I know I have a lot of amazing friends. It's just sometimes I do feel alone. So I think that's my biggest negative thought at the moment.
So the first thing you said, and as a good friend or as a therapist, I would say, I hear you're feeling alone. What's that like?
Oh.
And just kind of, you know, really hearing the feeling behind it. So you followed up with like, you know, you don't have to worry about me, I promise, because, you know, I have really good friends and I have all these things. You were already making it okay for me. But what I'm trying to show you is that like you indicated a need. There was a real need there that you do feel alone. And there's times where you don't feel good. So acknowledging that part of the you know, what you just said in a couple of sentences, just being like, I really feel like, I really hear you're alone. What's that like? I'm here for you. I want to listen about that. Or if someone says, you know, I'm really sad because I didn't get to go to my graduation. I hear you're really sad. So reflecting it back to them is a good way of being a good friend and acknowledging the feeling. You know, we didn't really get this, like these tools growing up. Our parents did the best they could, but we didn't there wasn't a lot of feelings talk or emotions talk. Same with in the classroom. We're getting better at social emotional learning, but there wasn't a lot of emphasis on the feeling that you're having. It was a lot of like, children should be seen and not heard sort of stuff in the classroom. Like, you just have to be on your best behavior and be a good student. So there was no acknowledgement of the emotions.
Right. I definitely noticed that growing up. Yeah, for sure. And I think what you said was really, really helpful. I feel like if people, did active listening like you just did more, and like we had more empathy for other people, and we really, really thought about what we are about to say before actually saying it, I feel like the world would be a way more positive place. So thank you for saying that. Yeah. So I love that. So as Molly said, toxic positivity is basically when you're dismissing someone's situation and you're invalidating their experiences and feelings by just being like, oh yeah, well, at least you have this, when you should not say that. You should like acknowledge that they're feeling this way and not dismiss that and be there for them. So definitely.
Abby, you said that way better than I could have.
Oh.
If you just summarized that way, I was like, I didn't even say those words, and that's exactly what toxic positivity is. So I just want to acknowledge that you said it better than I could have ever said it.
Thank you, Molly. Yeah, I was just like, okay, let's summarize this really quick, and then I just said it. But yeah, because I feel like if we don't understand what it is, but we keep doing it, like if we don't have that foundation of understanding it, then people won't learn how to stop doing it, or we won't learn how to identify it. Like when you see like a good friend saying it, you won't be like, hey, maybe that wasn't the best thing to say. Like if you don't even know what it is, you can't begin to stop it. So it's important that people understand what it is so we can be better, Yeah, definitely. So where do you think are some good self-compassion resources that young people like me can use?
Yeah, so Dr. Kristen Neff is like the leading researcher. I actually had the opportunity to go to her workshop when I was in grad school, and she's one of the leading researchers. She's up in Berkeley, if I'm not mistaken. And you can literally Google self-compassion, and her website is the first thing that comes up. And there's so many different exercises. The first one is writing a letter to a friend. Like, how would you talk to a friend, but you really write a letter to yourself. There's a couple meditation exercises. There's just a whole bunch of good exercises on there. And then I think I can get back to you about Instagram accounts, but I get inspired by Instagram all the time. It's not a substitute for therapy. I just have to say that. But I feel like there are so many self-compassion accounts that make you feel less alone in that area. And it gives you really good ideas about tools you can use for self-compassion. And I think that self-compassion and self-care go hand in hand. So if you're taking care of yourself in a really, compassionate way, that's automatically self-compassion. So I think that thinking about your self-care, doing that every day, I tell my clients, yes, therapy is great. You're coming once a week. If they're on medication, that's amazing. Like you're doing that every day, but what are you doing for your self-care every day? How are you talking to yourself every single day? Like therapy is great, but that can't be the only thing. Like the real work is when you step back into your life and you have to explore what that's like for the week and then go back into session, for an hour the next week, if that makes sense.
Right. Like it shouldn't just be like a once a week thing at therapy. It should be like a constant thing that you're constantly practicing and doing. So what is your personal favorite form of self-care that you do yourself?
That's a good question. Oh my gosh, so many. So I don't know if you can see in the background, I love plants. So I love tending to my plants. I have 2 cats. I call them my mindfulness consultants. So I really use them as my little mindfulness consultants. I meditate every single morning. I use the app Insight Timer, which is a really awesome app. Like you could literally look up any sort of meditation. And so I do the same morning meditation each day with affirmation. So that's how I start my day off with self-care. And I'm someone, because I identify as an empath, I can't be rushed. And so I make sure that I ease into my morning, I ease into things so I'm not feeling overwhelmed. And that's how I practice self-care. And of course, exercising, yoga, deep breathing, spending time with friends and connecting. Those are all on the menu as well. But I would say, like, I'm very cognizant from the moment I wake up that I have to take good care of myself.
Right, like starting your morning off with something that you can do for yourself, because I feel like we're in a very hustle grind culture where we have to like get really good grades and we have to like be the best in everything, that we forget to slow down. We forget to do the little things in the morning that could make all the difference for the rest of the day. And I really like what you said about you're an empath and you need to take things slow, because I resonate with that a lot. I really care a lot about people, so that means like I feel like I have to wake up really early and like get all these tasks done. And but I do sometimes feel like, me included, that we forget, like I said earlier, to really just, step back and do little things to practice self-care and self-compassion, because how are you supposed to help other people if you can't even help yourself? So
yeah, you got to fill up your cup. You have to. My clients ask me all the time, how do you do this all day? And it's because I fill up my own. Also, what I really love right now, since COVID started, the silver lining of the pandemic, is I go on something called comfort walks. So it's the same walk I do every single morning. And sometimes I listen to podcasts for different perspective. And I feel like it gives me, the comfort that I need on the walk. And then also gives me that perspective of like people who are really positive and people who like are vulnerable. That's something I think vulnerability is a strength. So I really gravitate towards people and podcasts and things that are vulnerable, and it allows me to be more vulnerable and show my heart in the world.
I love that. Yes, vulnerability is such a gift to this world, because we are all trying to find something and we're all like so focused maybe on the wrong things. So if we can just show the world like who we are, and that would encourage other people to do the same, and we could be more kind and we can understand each other better, because I feel like we are afraid of things we don't understand. And so if we can open ourselves up and be honest, then people would be more inclined to do the same. So I love that a lot.
Yeah, that's what we're doing now, like we're being vulnerable and we're both putting ourselves out there in a really important way. And part of the self-compassion that Dr. Kristen Neff does is this common humanity. Is like, we all suffer, like we all no one is immune to suffering or pain. And so acknowledging the common humanity of suffering helps us develop better self-compassion. That's why I say I want to be a human first, because I want people to know, like last week during the election time, I was suffering and I was anxious and I was uncertain. And so I had to let my clients know that too, because it's like, we're going to hold that space together. And I'm going to let you know that you're not alone in it.
Letting people know that they're not alone, especially in stressful times like right now, is so key to helping people right now. So I love that. So I guess my last question is, what is one piece of advice you give to our youth who are currently struggling right now with their mental health and loving themselves? Like, what is one piece of advice you would give them?
I'm thinking. Because if it's just one, I would say to reach out. That help is always available.
Reach out? Yes, definitely. What about the people who may struggle with reaching out? Like, what would you recommend for those type of people?
I would recommend for those types of people to think about who makes you feel the most safe and comfortable in your life. There has to be at least one person in your life that you can talk to. And maybe not, maybe it's for some people it's strangers. And so for some people it is like reaching out to this app, your app and what you're doing, or reaching out to a podcast. And then over time, like sometimes in social work, I have to just plant the seeds. Like someone isn't going to change right away. Someone's not going to go to therapy right away, but at least getting their brain working and planting the seed to reach out and normalizing that it's okay to reach out, whether it be through your app, a podcast, seeing other people go through it on Instagram, but just letting someone around you know in your immediate environment, because I have a feeling that people care a lot more about you than you think you do. And also there's crisis lines. There's one in San Diego. I'm sure there's one where you live. I think that there's trained professionals who you can reach out to and talk to.
I love what you said about planting the seed, because I've never thought of it that way before. Like what we're doing with your podcast and with Magnify is that we're literally like planting the seed for those people who feel unsure of where to look for resources. So I love that analogy. It's really great. But yeah, Thank you so much, Molly, for taking time out of your day to talk with me about the importance of self-compassion and loving yourself. We loved having you. If you want to see another YouTube video, be sure to like and subscribe. And our next YouTube video will be all about managing anxiety and coping techniques through journaling. So thank you so much, Molly, for being here. Have a great rest of your day, everybody.
Thank you.